Today's complication is one that every person living with sickle cell has to some extent: anemia. Now, you and I typically think about anemia as some type of deficiency with iron, because in a healthy person, when they have anemia, it's actually due to a decrease in iron production. The chemical iron in your body is what's actually responsible for producing the hemoglobin inside your red blood cells. Now remember, the hemoglobin are those passengers in the red blood cell car that carry the oxygen. So when you have an iron deficiency, you don't have enough hemoglobin inside your red blood cell to carry the oxygen, which is what causes anemia. However, in sickle cell disease, there's plenty of hemoglobin to go around. What actually causes the anemia is the decrease in lifespan of those sickled red blood cells and your bone marrow's inability to keep up with the production. So those red blood cells die off too fast, which in turn leads to a less amount of oxygen being carried through your body because there's just not enough red blood cell cars to do the job. So because of this, taking iron supplements, which you and I can do to increase our red blood cells and our hemoglobin, is not something a person living with sickle cell can do because they don't have a problem with iron. In fact, if they do take iron, it can be fatal because then they'll have something called iron overload. So the only quote-unquote cure for anemia with people living with sickle cell disease is something to help extend the life of the red blood cell, which at this point in time, there isn't really anything tried and true that has actually accomplished that consistently. There's a lot of things in the trial phase and a lot of research being done around that, but right now there's nothing that can help the anemia. In fact, if the anemia gets too low, people with sickle cell disease will have to get a transfusion, which the problem with those transfusions is it includes the iron, which we just told you they don't actually need, so then they have iron overload, which we will talk about during our transfusion thing. So this is just a short talk today about anemia and why iron cannot help the people living with sickle cell disease. Check us out on the web at hopeforscd.org and stay tuned as we talk about some more complications.